Good morning, good morning, good morning. Welcome to each and every one of you all. We are certainly blessed and privileged that you have joined us on this day, not just to attend this event, but also because we know that a number of people, a number of our loved ones, in fact, across the state of Georgia have been impacted by Hurricane Helene. And so before we start our official program, if we can just take a moment of silence to reflect, to thank God for our lives, to thank God for those, the people impacted that are still living, and also to pray for the souls that were lost in this devastation. Amen. Thank you. I am Dr. Kedrick Williams. Excuse me, Paul would want me to say I'm Reverend Dr. Kedrick Williams, Senior Rural Health Project Manager here at the Georgia Rural Health Innovation Center at the Mercer University School of Medicine, and I also serve as Associate Pastor of the New Howard Chapel Missionary Baptist Church here in Macon. And I stand to take on a very hard task, and that is to give welcome and greetings and remarks from our Dean, Dean Jean Sumner, the Dean of Mercer University School of Medicine. So I'm going to do my very best. She certainly sends her absolute best regards. She currently is in flight, traveling internationally to a conference, but she sends her best regards and wishes that she was here with you all in person. On behalf of Dean Sumner and the Mercer University School of Medicine, we are really excited about this opportunity for rural Georgia to bring pastors, ministry leaders, ministry lay leaders, and physicians and healthcare professionals together in one room to help patients. This is an initiative, the Faith in Rural Health program, that you will hear about very soon by its illustrious leader, Reverend Paul Bird. But this initiative is certainly long overdue. We've received such good endorsement and support as an institution, as partners for this program, and we're really excited to be a part of it, as we've discovered across rural Georgia that there's a significant need to merge and to marry, if you will, medicine and ministry. Dean Sumner is a still is a physician, retired physician, and has served in a number of areas, particularly in the Washington County area. And she has indicated that she's seen the importance of the presence of a minister, of a pastor, in the midst of patient care. Particularly because people in general are close with their faith leaders. And they recognize that if my faith leader can be present when I'm receiving a diagnosis of some illness or sickness that I don't want to receive and don't want to hear about, that faith leader can provide support and can provide comfort to me and allow me to be a little bit more at ease in knowing that I am well taken care of. And so Dean Sumner also recognized that a physician and a pastor or faith leader supports one another. Both work in areas of work that are extremely stressful, extremely time consuming, for lack of better words, extremely energy consuming as well. And so it's important to note that one can support the other, one can encourage the other without stepping over boundaries, without trying to direct a pastor in the church if you're a physician, or direct a physician in a hospital or healthcare office setting if you are a pastor. And so in addition to providing that welcome and those greetings on behalf of the School of Medicine, I want to ask each of you to participate in an illustration with me, if you will. As most ministers, we do this. And so when you think about this here, M&Ms. Now I have a yellow shareable bag. It may not be enough for everyone in here to get some, but these are peanut M&Ms. When you think about M&Ms, what's the first thing that comes to your mind? The very first thing, just yell it out. I heard chocolate. Delicious. What else? Melt in your mouth, not in your hand. I heard calories. Absolutely. I heard nuts. What else? I'm looking for another word. It starts with an S. Sweet. Absolutely. M&Ms are sweet. And there's also something very unique and sweet about this room and about this gathering. And that is you all are here representing medicine and ministry. You are our M&Ms. You all are, yes, you are. You are. You are our M&Ms. You are what makes this Faith in Rural Health Summit, what makes the Faith in Rural Health program super sweet. We cannot do this without you. None of our partners, and I know Paul is going to share more about those when he comes, but none of us could do what we do without you doing the phenomenal, great work that you do. And we know that it's not selfish work that you do, is selfless work that you do. You were called, whether you're a physician, a healthcare provider, you were called, whether you're a pastor or ministry leader, you were called to serve in that role and in that capacity. And so we are certainly grateful that you're here doing the work that you're doing, but you're also here today to participate and actively engage in this summit. So if there's anything at all that we can do, Greek staff table, if you all would just raise your hands real quick. All of us are here and available to accommodate you, any need that you may have. Come see us. We also have our name badges on, may also have the Greek cross on, but let us know if there's anything that we can do to make your stay here today all the more better, okay? Thank you so very much.